Hi, I'm Peter Roderick. I'm a consultant in public health, and we're really aware, as I'm sure you are, that the rates of children that have had a streptococcus, a strep A infection, have been rising recently, and lots of reports in the media about children being sick. I wanted to talk a little bit about what we're seeing from a public health perspective, which is a rise in the number of children with diseases like scarlet fever, which are caused by strep A. However, to put it in a little bit of perspective, we know that strep A can sometimes lead to some really nasty invasive diseases, but the vast majority, maybe sort of 99 out of every 100 cases, are self-resolving, and if you get antibiotics quickly, easily treatable. And we know that the numbers of children who are getting very sick with an invasive infection are still relatively low, but there are some really simple public health messages that we'd like people to take away, and that's really my key point, is to think about what we can do as communities to just prevent ourselves getting these types of infections and prevent us needing to access really busy GP surgeries. Now, the first thing is to think a little bit back to March 2020, about when we all got really serious about hand washing. Let's go back to that place of remembering to wash our hands regularly before eating, and making sure we do it for at least 20 seconds, and doing a really thorough clean of your hands. Catch it, bin it, kill it messages, so when you cough or sneeze, to catch it in the tissue, to bin it, and then kill it by washing your hands, kill the bugs and the bacteria that you might have on. And then thinking about, if you are ill, or if your child is ill, just thinking really carefully about sending them into a school or into any other setting with other children around. Usually we say if someone has had a diagnosis of scarlet fever, they need to have at least a day's worth of antibiotics before they should go anywhere near a school setting or other children. If they don't get antibiotics, it's actually up to 3 weeks before the infection can really clear. So just be really cautious about taking your children places when they're ill at this present time, and try to use the most appropriate services to get your healthcare. 111 and your GP are there for you if your child is seriously ill, or if you're really concerned, obviously ringing 999 or going to A&E. Thanks.